Good morning. Today is Wednesday, February 25th, 2026. And I just have an update. I had a doctor's visit yesterday and I went to go see the results, talk about the results of my MRI that I had on literally this Monday this week. So the first thing I want to talk about is my ACL was not torn, incredibly. So I went down pretty hard about 2 or 3 weeks ago playing soccer. I was cleared to play. Didn't feel good, or I felt good, and then my knee gave out on me. I had my brace on and everything. I was playing conservatively, and my knee just gave out. I felt, not as bad as the first time I tore my ACL, but I was like, it's the same feeling. I felt some popping, some crunching, and I was like, yeah, okay, I'm back to square one. So I'm going into this MRI thinking, all right, let me just get this over with. I know it's torn. Turns out it was not torn. Not even really suspected of a partial tear. And what they think happened was because there's definitely swelling and pain. I'm kind of have a little limp when I walk. So there's a partial or if not a complete MCL tear. And the reason the doctor thinks that happened is because my ACL, which is a allograft, which is a donor tissue. Just a little recap. I got my first surgery back in March 7th, 2025. So I waited a whole year. Apparently the allograft, they're kind of known to do it sometimes. Is not really incorporating into my body. Maybe like it should, for whatever reason. So even though it's intact and it's not torn, I think he showed me like where it inserts into my bone. It's just not taking for some reason. So even though it's not torn, it's not really functioning like it. It's not keeping my knee locked in place, and because of that, my knee is not stable, and so that's why it gave out on me when I was playing soccer. And as a result, now my MCL is torn, and which is not too bad because the MCL at least isn't inside the knee, so better blood flow, faster recovery. But there's a possible meniscus tear, but MRIs aren't really conclusive as far as that goes. So that's something they really decide on the surgery day. They go in there and they see how bad it is. I talked about that in my previous video. If there's meniscus damage, it's a slightly more cumbersome and difficult recovery because you have to be in a straight brace and non-weight bearing. But last time I was lucky, I didn't have any meniscus tear. I'm hoping this time with surgery, it will be like that as well. Quick. So my doctor says I do need the surgery because honestly, I'm 29 with this allograft. I probably should have done it the first time, just gone with the autograft. Allografts are not really recommended for active people who are younger. And so I'm 29, so I was kind of at like the border between young and old as far as allografts are concerned, but I'm just too active. I'm still playing soccer, and so this time he says, you know what, it feels like this is just gonna keep happening. So even if the ACL is not tearing, so let's get this surgery done with. Let's get you the autograft that you need. I'm gonna do this whole process again, but hopefully, honestly, at this point, like, I don't mind if I have to wait 2 or 3 years. Like at some point in my life, I like to play soccer again. So this is the way to go. I'm doing the autograft. And he also said at first he recommended something called LET. It's kind of like an upcoming medical procedure that enhances the rotational strength of knee stability when doing ACL constructions or reconstructions and or revision. Sorry. And he said it's not the golden standard yet in medical practice, but he says in about the next 5-10 years he thinks it will be. There's strong evidence that has been supported from many procedures that have been done, saying that it enhances rotational stability. And what they do is they take part of your IT band, which is on the outside of your leg, and they and they will take a piece of that and add it. Like they'll like I think it's I'm not too clear. You can look it up, but it's like they'll add an extra ligament to your LCL, which is your lateral cruciate ligament. Like you have the ACL middle, then you have MCL, which is on the inside of your knee. on the side, and then you have on the other side, on the outside, you have the LCL, lateral cruciate ligament. So they'll add to your LCL, and that kind of just enhances rotational stability. That's what was explained to me. You can again look it up. It's called LAT, something like that. And he recommended it. But then he called me right after my appointment and said, "Hey, I don't think that's really the issue here. The issue here is even though usually you don't need to repair MCLs because it has good blood flow and it'll repair on its own, he recommends so it doesn't happen again, just to be extra sure, we're gonna reconstruct your MCL using a donor tissue because with MCLs you pretty much can only use donor tissue. There's nowhere else in the body where they can really take to reconstruct an MCL, and they're already gonna take from my I'm doing the patellar tendon autograft, so they're taking from my patellar tendon, which is bone to bone on both ends of that graft. Allows for better incorporation and healing. It's supposed to be among the strongest. It's kind of like the gold standard for professional athletes and what they do when they get hurt. So they're already taking that. They're going to use that on my ACL to get rid of this donor ACL, which isn't working for me. And then for extra security, they're going to add MCL with a donor tissue, and they do something called bridging. I think it's like internal reinforcement. They add some extra material to it to make it even stronger. And like I said, luckily with MCLs, that just doesn't take as long as an ACL because it has much better blood flow. It's not in the middle of the knee, kind of isolated inside there like the ACL is. What else do I need to talk about? Yeah, meniscus they're gonna see on day of surgery whether that needs to be fixed or not. I'm hoping it's not, because that was really good news when I had my first surgery, that it was no damage, so I could pretty much get up and move the next day. Like I said, I'm going with the autograft. My surgery is March 18th as of now, so it is February 25th, March 18th, give or take, half a month. I already have pretty decent range of motion. I'm walking even without a brace sometimes, so we will wait until March 18th, and then that's pretty just a little quick update for y'all. Feeling wise, I've been going to the gym, sticking upper body, not really able to do much walking or cardio still. I hit the pool sometimes, do some swimming. Even that kind of bothers my knee a little bit. I'm trying not to use my legs as much when I swim, mostly upper body. It's kind of been my routine lately, so just keeping you updated on this journey. Hopefully it helps somebody, and until next time, peace. And no physical therapy recommended so far. He didn't say anything about it, so I'm just chilling on my own for now, and I don't think I need it either. And honestly, to be honest, I don't know, because if it's going to be the same procedure as last time, I don't even know if I'm going to need physical therapy after I get my surgery this time, because it's I've already been through the whole thing. I know exactly what to do. I even have TheraBands, those elastic bands in my house that they gave me, so I might not even need physical therapy at this point. Who knows? I need to do work, but I don't know if I actually need to go to physical therapy because I stay active. So until next time.